Hi there, my name is Amir Ginsberg. I'm a specialist in internal medicine and chairman of Trillium's Medical Quality of Care Committee. This short talk is the fourth in an educational series about patient safety and is titled Safe Medication Practices. If you want to take a closer look at some of the information in the accompanying slides, please pause this video at any time. Medication errors are a common cause of adverse events in our healthcare system. In 1999, the Institute of Medicine in the United States reported that 2% of patients admitted to hospitals experience an adverse drug event that often increases the length of their hospitalization and is associated with high costs. The 2004 Canadian Adverse Events Study showed that 1 in 4 adverse events are medication-related, and this is second only to events related to surgical procedures. So why do adverse events happen? There can be dosing errors. A correct medication can be given to the wrong patient, and incorrect medications can be given to the right patient. Sometimes medications can be given despite known allergies to them. And finally, missed doses of important medications can result in adverse drug events. Children who often require complex dosing calculations and seniors who often are taking multiple medications are particularly at risk of adverse drug events in hospitals. At Trillium, we have several strategies in place to make sure that we give the right drug and the right dose to the right patient at the right time. One of these strategies is called medication reconciliation, where a member of our pharmacy team partners with you, your family doctor, your community pharmacist, and with others to determine exactly what medications you are taking. Obtaining this best possible medication history allows your care team to correct any discrepancies arising in your admission process and to prevent an adverse drug event from occurring. And when you are discharged from the hospital, Trillium physicians use a structured prescription that communicates to your family doctor and to your pharmacist about any new or changed drugs, if any drugs have been stopped, and what medications to continue as prior to your hospitalization. Another strategy is our culture of safety around the use of medications that are known to be at high risk for adverse drug events. These high-risk medications have been removed from clinical areas to minimize any chance of error and are now prepared in the pharmacy department by trained experts. Before any medication is administered to any patient, our caregivers use 2 pieces of information to be absolutely certain of a patient's identity. This ensures that the right medication reaches the right patient 100% of the time. Our pharmacists are completely integrated members of our interprofessional care teams. They will assist in tailoring your treatments to your needs and will adjust your medications if you have any kidney or liver problems, or if your medications need special monitoring. And finally, our seniors health team pharmacist can do house calls for older patients to review their medications and recommend changes to reduce potential drug risks. Here are some tips for patients to prevent adverse drug events. Bring all of your medications and pill bottles or a list of your medications with you on your visit to our hospital or to our outpatient clinics. Let your care team know if you are taking any herbal or over-the-counter medications, vitamins, supplements, or natural remedies. Know the name of your community pharmacy and their phone number, and try to use only one community pharmacy. If you are admitted to the hospital, make sure your doctors, nurses, and caregivers check your wristband and ask your name before giving you any medications. Tell your caregiver if you don't feel well after taking a medication, and ask for help immediately if you think you are having a side effect or reaction. Ask to speak to one of our pharmacists to make sure that you understand your new medications and any changes being made to your usual medications. As you can see, our commitment to safe medication practices is critical to our relentless pursuit of the highest quality care and safest care for our patients.